For me, going through postpartum depression, it was one of the most awful experiences in my life. This disease robs you of the joy of being a mother, and it makes you question why you became a mother. As soon as I delivered my son, I started to get very confused thoughts I didn't like, panic attacks. I could barely pick up my child because the overwhelm was so intense. I had to take my child to get his bilirubin checked in the maternity ward, and I laid there with my head on my husband's lap saying to the nurse, "Please find my doctor, something isn't right, something's not right." And she came back, she said, "I talked to your doctor, he says to drink more water." That just propelled my illness.
So the Periscope Project, it is designed to give confidence and education to our frontline providers caring for perinatal women.
As an OBGYN provider, we're not expertly trained on the mental health piece, and we know that optimal mental health functioning is vitally important for improving birth outcomes.
It is difficult sometimes for patients to share what they're struggling with simply because they feel like as a new mother they should be enjoying every moment, and that really isn't necessarily always the case.
What I found in my own practice is a lot of these questions can be handled by a simple conversation.
You feel like nobody understands, nobody gets it, and you just don't know where to turn, and you can't escape because you are taking care of a child. You have children, these babies need you.
The highest rates of psychiatric hospitalizations in women is in that first year immediately post-delivery.
Moms are not thriving because of this disease, and many moms are dying because of this disease.
The Periscope Project was created because of the lack of perinatal psychiatric services, not only in Wisconsin, but across the country.
It is difficult, or patients are waiting 4 or 6 or 8 weeks to see a specialist. If we have real-time access to care, providers are more comfortable and can treat their conditions as quickly as possible.
The Periscope Project has 3 different components. The first component is this teleconsultation piece, where a provider can pick up the phone and be connected to a perinatal psychiatrist within 30 minutes. They could be asking questions about screening tools, diagnostic clarifications, psychiatric medication use in pregnancy or breastfeeding.
There's a lot of fear about using medications, and that expertise of a trained mental health provider is important.
The second component of the Periscope Project is continuing education for our providers. So a provider will be able to log on to our website, view a 15 to 25-minute video about these topics, and be able to gain comfort to treat their patient. Here in Milwaukee and southeastern Wisconsin, we actually have quite a few resources dedicated to perinatal women who are struggling with psychiatric or substance use disorders, and being able to help connect that provider of that patient to the right program is what we're aiming to do. It's a free service to have access to subspecialty consultation services. There's not any reason not to sign up.
I would absolutely encourage every healthcare provider to enroll in the Periscope Project just to have access to these experts.
You can't do it alone, so it's great to have a program like this.
The Periscope Project saves lives. It saves moms' lives, it's going to save children's lives, and it's really going to change the course of maternal mental health in our community.